I'm 39 years old and I had depressions under my eyes for as long as I can remember. Any suggestions? What procedures would be the most effective in rejuvenating my upper and lower eyes?
Thank you for your question. You're 39 years old. You've submitted two photos, one close-ups of your eye and forehead area, one with your face relaxed, one with smiling. And you're asking about what to do about your upper and lower eyelids. And you also mentioned that you've had depressions under your eyes. So, in looking at your photos, I can just share with you the approach that we have in our practice and how we discuss eyelid rejuvenation when people come to us. I'm a cosmetic oculofacial plastic surgeon practicing in Manhattan and Long Island for over 20 years. And this is pretty much what we do every day. So I'll tell you that there are a few things that you should look at besides looking at the close-up of your eyes. I'm also boarded in general cosmetic surgery, including face and body, breast, and extremity. And so I also do a lot of facelifts. So we kind of look at the eyes from not only the perspective as a specialist in eyes, but also as a specialist in facial rejuvenation. And the reason I'm saying that is that when you look at yourself and you are bothered by the appearance of your eyes, sometimes you get so focused in this area that you miss the details on the rest of the face that contribute to the overall appearance. So, when I look at someone's eyes, I also look at the midface, what we refer to as the submalar or the cheek area, and you look at the eyelid and cheek junction. Now, why is that? Well, paradoxically, not only do you start to see puffiness under the eyes, but you also see volume loss in the cheek area. So, with that being said, let's just analyze the appearance of your eyes. The upper eyelids appear to have some extra skin, some fine wrinkling in this area, and the lower eyelids appear to have puffiness and fine wrinkling of the skin, and of course more wrinkling when there is muscle activity such as smiling, as you show in your photo. In our practice, it's routine to perform something called an upper eyelid blepharoplasty for the upper eyelids, and this is to reduce the excess amount of skin, sometimes also sculpt the fat that's underneath the eyelid skin, the orbital fat, as well as the subbrow fat, and do a nice closure to minimize the appearance of the upper eyelid incision and allow for a natural appearance and rejuvenation. Hooded upper eyelids tend to make people look sad and tired. It dominates the intrinsic natural shape of the eyes, and so no matter how nice the eyes may have a shape, the hooding actually makes people look tired. So it can be quite dramatic and at the same time look very natural. With the lower eyelids, you have what we call lower eyelid fat prolapse. Lower eyelid fat prolapse means the fat that's normally around your eyes, it pushes forward and creates like a hernia and creates puffiness. In reference to your comment about depressions, if you think about it, when there is a relative depression, one that was already there, something you were aware of, when there's volume adjacent to it, it's like a mountain next to a valley, and it makes the valley look deeper. So I would suggest that in addressing the mountain, what we would perform is a lower eyelid blepharoplasty. Now, there are two ways to do a lower eyelid blepharoplasty. One is from the outside, called a transcutaneous blepharoplasty, which means making an incision underneath the eyelashes. In our practice, we do something a little bit different for most of our patients. It's called a transconjunctival blepharoplasty. This is the approach from doing the procedure from the inside of the eyelids. From my personal experience, although I certainly can do all these procedures and much more advanced procedures, I like doing the transconjunctival blepharoplasty because it tends to retain the natural shape of the eye very nicely. It allows for preservation of the lower eyelid support structure, the orbicularis muscle and the tendons and everything else. As a specialist, I am called upon by patients who come from all over the world to revise lower eyelid position and problems, because the lower eyelid is actually deceptively complex. There are several key structures that are necessary to be in balance in order for the lower eyelid to retain a nice shape. A lot of times people have something called lower eyelid retraction or ectropion, where the eyelid actually everts away, and they come for revision surgery. So when I do this procedure, I'll address the herniated fat or the fat prolapse that pushes out and creates those bulges from the inside of the eyelid. And then if we're dealing with fine lines and wrinkles, we actually use two methods. We use fractional CO2 laser, which is a laser that combines both ablation or removal of the top layer of skin, as well as generation of thermal energy into the dermis, or the backbone of the skin, to create tightening. We also use regenerative medicine technology, that is, it's called platelet-rich plasma. Platelet-rich plasma is derived from your blood, and it's basically using the same technology that's being applied in orthopedics for joints and for wound healing, and applying it to the skin to stimulate new collagen, blood supply, and improvement in skin quality. In conjunction with the fractional CO2 laser, we really are very pleased with those results. Now, during my consultations, I always point out to my patients how the volume in the cheek area, where it is prior to the surgery. A lot of times people will be concerned about potential hollowing after this type of surgery. And it's not so much about taking out too much fat under the eyes. It's actually because they didn't realize that there was volume loss in their cheeks. And so although the negative of the puffiness was reduced and they looked better, they then focused on the volume loss in the cheek and wondered why that wasn't pulled up with the eyelid surgery. It frankly just isn't practical. It's not realistic to pull up this volume, and because there's an absence of volume, even a mid-face lifting procedure may not be adequate because there's a volumetric loss. I always describe that the cheek volume in the face with aging changes kind of like the breast volume does with aging, where the upper pole of the breast diminishes and the size of the breast actually diminishes, combined with descent. So there is a reality of facial aging, whereas there is both volume loss and descent or sagging. So a game plan for you is to do what a lot of our patients do, which is address the negatives, the extra skin over the eyes, the puffiness under the eyes, the fine lines and wrinkles. Be aware of the volume in the mid-face, and either choose to do something during the procedure, and options include things such as fat transfer, submalar implant, or injectables such as Radius, Restylane, or any of the other hyaluronic acids, and trying to balance that out so you do a lot of things at the same time. Other options to do it afterwards. But understanding globally what your appearance is prior to surgery, and then coming up with a plan afterwards is usually a good strategy from the word go. So I would suggest you meet with qualified, experienced cosmetic surgeons who have a lot of experience with eyelid surgery. I really strongly believe in extensive experience in any area of cosmetic surgery. I think that it always allows the patients to have a more predictable result, and when a doctor has a specialization and the experience in that specialization, then it's a matter of matching the patient's aesthetics with the doctor's aesthetics to get the desired result. So I hope that was helpful. I wish you the best of luck, and thank you for your question.